Hello, and welcome to your pre-surgical rehabilitation education session. In this presentation, you will learn what to expect while you're in hospital and after you've had your joint replacement. You will learn about precautions. These are things you're not allowed to do after surgery. You'll learn about what equipment you'll need, tips on dressing after surgery, how to get in and out of bed, how to get in and out of a car, and how to navigate stairs. You will also be shown what exercises to do, learn the signs and symptoms of infections and blood clots, as well as find out what physiotherapy is offered after your surgery. After your joint replacement, we will try to get you moving as soon as possible. This includes getting out of bed and walking. After surgery, you are more at risk of developing a blood clot because you're in bed and not moving around as much. This can cause your blood flow to slow down, which can then pool and form a clot. To reduce the risk of this happening, you will be given a blood thinner and you're encouraged to get moving. Pumping your ankles up and down regularly throughout the day and getting up and walking around as soon as you're able can also reduce this risk. Lung complications, such as chest infections, can occur as a result of the anesthetic and being in bed and not moving. One way to open up and clear the lungs of anything that collects at the bottom during surgery is to take a few deep breaths and then cough. Do this 5 to 10 times every hour while you are awake. The best way to help clear your lungs is to get up and move around. As we get up and move, we naturally take deeper breaths. Most patients go home the day of the surgery following a direct anterior approach hip replacement or a unilateral knee replacement. If you are having a total knee replacement, you can expect to go home 1 to 2 days after your surgery once you have been cleared by the doctor, nurses, and rehab team. There are certain things that we require of you before you can go home from the hospital. You will need to be able to get in and out of bed on your own, walk safely with a walker or crutches, get up and down stairs if you have stairs at home, and be able to do your exercises given to you by the physiotherapist. When thinking about going home after surgery, please make sure you have a plan. If you live alone, you may need someone to come and stay with you initially after the surgery. You will also need to make sure you plan what vehicle will be picking you up and ensure that you will be able to get in and out. If you are having a total hip replacement, you may have to follow certain rules or precautions. These are no bending past 90 degrees, no crossing your legs, and no twisting. The muscles and ligaments that normally keep the hip joint in place get stretched and weakened during a total hip replacement surgery and require time to heal. While healing, they are weak. Movements such as crossing your legs, bending forward, sitting in a low chair, twisting or stooping may put too much pressure on the healing muscles and ligaments and may cause the joint to dislocate. You should stick to these precautions until you are told otherwise by your surgeon, which is usually about 6 weeks. If you are having a total hip replacement with the direct anterior approach, you will likely not have any movement precautions. Pain and swelling are normal after a joint replacement. Make sure you take your pain medication as prescribed, as this will allow you to move more with less pain. Try not to let your pain get above 5 out of 10, where 0 is no pain and 10 is the worst pain imaginable. When your pain gets higher than this, it's more difficult to get back on top of it. Ice and elevation can help to reduce pain and swelling. When elevating your leg, you must get your foot higher than your heart to help decrease the swelling. You should only keep ice on the joint for 15 to 20 minutes at a time to avoid an ice burn. However, if you have a cryo-cuff ice machine, this can stay on longer as it is constantly circulating and the cold will not damage your skin. For your surgery, you will need a two-wheeled walker, crutches if you have any stairs, a raised toilet seat, and something to help with bathing, for example, a bath bench or shower stool. You can borrow these from the Red Cross. A form will be completed for you and faxed there by a therapist prior to your surgery. You may find a leg lifter helpful for getting in and out of bed after surgery, pictured here on the bottom right. It hooks around your foot so you can lift the leg in and out of bed. A sock aid and long-handled shoehorn can be helpful after a lateral hip replacement, as you cannot bend down past 90 degrees to put your socks and shoes on for at least 6 weeks. A long-handled reacher helps to pick things up from the floor after surgery, as again, you cannot bend past 90 degrees with a lateral approach on the hip replacement. These items are available to purchase from many medical supply stores and pharmacies. You should aim to pick your equipment up from the Red Cross about a week before surgery. If you think a leg lifter, sock aid, long-handled reacher, or shoehorn would be beneficial for you, then you should get those before your surgery as well. The list of medical supply stores in the South Okanagan will be emailed to you. Next few slides, you can watch a video on how to get in and out of the shower and how to use assistive devices. From the time you wake up from surgery, your implants are strong enough to walk on with full weight bearing. There is no time required to stay off your feet or to restrict how much weight you put on your leg. In fact, the surgeons want you walking and improving your mobility each day. When using a walking aid, you should place the walker or crutches in front, then step your surgery leg, then the good leg. Try to remember to get your heel down first, then roll onto your toes and bend the knee when swinging it through. Do not hold your leg stiff and straight. There is no specific timeline for how long you should be on a particular walking aid. However, walking with a limp can put increased stress on the muscles around your back and hips, which could cause more pain. Limping indicates it's too soon to progress from your walker or crutches. After your surgery, you will need to use a walking aid. To ensure your walker is the right height for you, the hand grips should come to the level of your wrist with your elbow straight. This way, when you have your hands on the walker, you will have a slight bend in your elbow. If the walker is too high or too low, it can put stresses on other joints and make it more difficult to walk. When fitting your crutches, the top should be 3 to 4 fingers away from your underarm. There are lots of blood vessels and nerves under your arm that can be compressed if you're leaning on them. The hand grips again should come to the level of your wrists so that you have a slight bend in your elbows when you're holding the crutches. While you are in hospital, you will be given these exercises by the physiotherapist. Try to do these exercises 2 to 3 times per day, every day at home until you see a physiotherapist who will progress them. These are the exercises given after a hip replacement. You should do these 2 to 3 times per day for 6 weeks after surgery. In your big total hip replacement book, you will find exercises to progress to after these. When going upstairs, remember to go up with the good, non-surgical side first, then the surgical side, then crutches. When coming down the stairs, lead with the crutches, then the bad or surgical side, then the good side. See the videos in the next 2 slides for demonstrations. After surgery, you are more at risk of developing a blood clot because you're spending more time in bed and not moving around as much. This can cause your blood flow to slow down, which can then pool and form a clot. To reduce the risk of this happening, you will be given a blood thinner and you're encouraged to get moving. Pumping your ankles up and down throughout the day and getting up and walking around as soon as possible can also reduce this risk. If you notice that your calf is very swollen, painful in a specific spot, or is red and hot, these are signs of a blood clot and you should go to the emergency room. You are also at risk of infection following surgery. If you notice that there is lots of weeping coming through the dressing, redness around the incision that is spreading, or you are feeling generally unwell and feverish, these could be signs of infection. You should go to the emergency room to be assessed. If you have extended health benefits, we encourage you to attend private physiotherapy. See the email document for a list of private physiotherapy clinics in the South Okanagan region. There are outpatient clinics in Penticton General Hospital, South Okanagan General Hospital, the South Similkameen Health Centre, and Princeton General Hospital. Your hospital physiotherapist will refer you to one of these locations. You will generally be assessed by a physiotherapist 2 to 3 weeks after your surgery. Whether you've had a hip or knee replacement, you should continue to work on the exercises you are given in the hospital until your outpatient physiotherapist directs you otherwise. If you have any questions about the information in this presentation, you can send an email or call the rehab department. This contact information is also in the email you have received from the rehab team. Good luck with your upcoming surgery.